Good afternoon and welcome. My name is Jason Hageland. I'm your presenter today, so I have a lot of background, both in the behavioral health sector. Spent my entire career working in crisis and mental health issues, mental health care, mental health literacy, and training. And in addition to that, I'm a farmer, so fifth generation Iowa farmer, and so it's kind of fun when I get to um, have a presentation where I can talk about um, my agricultural roots and what I still do on the farm, raising corn and soybeans right here in central Iowa, along with overlaying that, 80% of Iowa's economy and across the Midwest is agriculturally related. And so as we think about farming and our roots in agriculture and processing of different livestock and the dairy industry and stress. And so I thought this would be a great opportunity to talk for just a little bit. And, let me just tell you, if you have questions, pop them, either use the chat or the question function. I'd love to respond to things individually. It's always a challenge doing these types of webinars. I love seeing faces and I love answering questions and having a dialogue, and that certainly can be a challenge, especially where we are. So, as I talked about, that's my son. Last fall, we're getting ready to harvest. Hopefully tomorrow we'll be harvesting soybeans. 135 years ago, it started for me right here in Iowa. So my son will be the sixth generation. There he is sitting in the tractor. That's in 1885. The picture up you see there, that's actually him in 1899. That's J.B. Hageland. And so that's some of the land that I still farm today. Actually just recently found his naturalization papers, which was kind of fascinating. So, when we think about farming, we think about agriculture, we think about technology, things are very different today than they were in even 1885, 1899, the turn of the century. We get a lot more yields today. The technology we have today is very different. And so it's kind of just interesting sometimes to put a historical perspective on everything. And so just a quick reminder for everybody, what is stress? I don't know if you can see this picture in the background or not, but I'm not a patient individual. And so for me, stress is sitting in that truck line here. And when harvest is coming around, just sitting and waiting, to dump the grain that I'm harvesting. A stress can affect all of us differently. Stress is how the brain and body responds to something. And certainly there is no shortage of stressors right now. We look across not only the state of Iowa, across the country and around the world, and we know that there's significant things going on. There's significant traumas that we're all experiencing. We have to remember that a disaster like the pandemic is a traumatic event. The derecho that went through Iowa, who knew we would experience a land hurricane here just a month ago. And so all of those things can play into our stress and how we manage those things. We know long-term stress can be harmful to our health. We know that how we manage it and how we have our employees manage it is exorbitantly important if we want everyone to be their very best. As we think about how we react to stress, we need to think about that over time, that stress wears on us, and as our reactions increase, there's more likelihood that our reactions could be maladaptive and potentially disruptive to our ability to carry out our daily functions, so our ability to work, our ability to take care of our families, and do the things we do in our communities. It's always nice when we can kind of take a look at what are some of the warning signs. And so this is, certainly from a farming perspective, but this is very adaptable to a work setting. or even a family home setting. We think about what are those big warning signs and indicators to walk for. Fatigue, distraction. I always like, talking about absenteeism and presenteeism. Presenteeism is when someone's there, but they're not there. They're physically, going through the motions day to day. In agriculture areas, we see increases in farm accidents, not taking care of animals, not feeding animals, not taking care of farm equipment, increasing isolation. And the thing we need to think about is some of these warning signs and indicators are things that we've been forced into because of the pandemic. We've all had to change our routines. We're all experiencing, to some level, a greater isolation than we have in the past. And so over time, that prolonged stress certainly can wear on us. We know pre-COVID-19, I'm sure most have heard the statistics, 1 in 5 adults will experience addiction or mental illness in any given year. We're aware that we have a large treatment gap in our country, that a lot of folks have a need for additional supports, yet only about 40 or 50% of those people, some estimate less, ever actually receive services that they need. One of the things that I follow quite closely is U.S. Census Bureau does a weekly pulse survey, and I find this survey to be a good litmus test of exactly how Iowans are doing. And so Iowans are a pretty resilient bunch. Anyone who's from Iowa or the Midwest knows that we can take a lot in stride. So this is just a quick poll that's done weekly that indicates the number of symptoms of anxiety and depression. And so pre-COVID, if we look at a 6-month phase, the baseline, if you will, was 11% of Iowans really expressed symptoms of anxiety and depression. The last week in July, 38% of Iowans expressed anxiety and depression. So we know anxiety and depression has increased greatly due to the pandemic. Now, we also know, and that's the most recent data I could pull. I think the survey went on hiatus for a few weeks, and I think there's some data back now. I think it dropped just a little bit. It's still in the mid 30%. So it helps us to kind of anchor what we kind of feel and think we're seeing in our communities with some data. And so we need to think about our communities, our workplaces, the people around us. How are we supporting them? How are we acknowledging the anxiety, the uncertainty, what's happening around us with the storms? Most of Western Iowa experienced a drought. On my farm, we're having lower yields because of the drought that occurred over the summer. And so with everything else going on, we're hardly even talking about the drought that happened across most of Western Iowa. And we still have folks, suffering in the eastern side of the state after the derecho. There was just a big storm that went through northern Iowa with 80 or 90 mile per hour winds a week ago. So certainly, we know that all of those things are happening at once. And so all of these compounding factors with what we knew about our mental health wellness going into this, adding all of these compounding stressors and disasters and events, and then not forgetting that we were in the midst of an opioid epidemic. And so, especially within our agriculture and rural communities, 3 of 4 farmers, had indicated, this is a survey going back to 2017, that they would have no problem accessing prescriptions and opioids. And only 1 in 3 said it would be easy to access treatment. So kind of going into all of these stressful events and these things that we know when we look to other pandemics and disasters around the world, we go back to SARS in 2003, we know that there's an impact on society for the 12 to 18, 24 months post any type of major disaster or pandemic, where generally we do see increases in depression, increases in substance use disorders. And so all of those things really do play a role. as we think about agricultural and farmers per se in the traditional sense, let's not forget that the number of people farming and taking on that role is much less than it used to be. I kind of called back to the late 1800s. Over half of the population at that point in our country were farmers and taking care of the land and producing things for themselves. Today, only about 1% of the American workforce is truly a farmer and taking things off of the land themselves. And so it doesn't mean that they're all large-scale farms. Family farms, family-owned farms are still the majority. The average size of a farm these days is right around 450 acres. And so as we think about that, it puts a great deal of burden on a much smaller segment of the population. And we also know it takes a lot of other industries and sectors to support that much smaller population. So, when I look across the state of Iowa, we think about fertilizer companies, we think about co-ops and elevators, we think about the processing plants, the pork processing plants, turkeys, chickens, cattle. Some of our largest employers in the state is Tyson, 14,000 employees. And those are necessary, essential workers to keep the pipeline in order for all of the products. You think about John Deere, I think about all of the different sectors and businesses that go into successfully creating the agricultural community. So, early in the year, we talked about the financial strain and uncertainty. We had trade agreements, ongoing farmers struggle with health insurance and having access to treatment. We talked about the gaps, a few minutes ago. Farming in its nature isn't stable. Costs are increasing, adding a pandemic on top of that. Certainly challenges a farmer's ability to do well. And I say that tongue in cheek, and soybeans are up 20 cents today. The markets are not even close to what we had expected because of so many things have changed just in the last couple of weeks. And so, we're experiencing kind of a roller coaster that's even a little bit beyond what we normally see within the farming community. And so, in the agricultural communities, we're used to ups and downs. We're used to not knowing what the markets are going to do, or the markets, really on the whim of what's happening politically or trade agreements. But those things have really been under hyper focus, I think we could say, this year, and compounding that with everything else that's happening has been very stressful financially. On a side note, about 36% of farmers' income this year will be subsidized by the government, which is going to help immensely this year. And so it really does then question how farming and agriculture related industries are going to be able to recover next year. A majority of farmers thought they would be impacted. And so, there's been a lot of research done about mental health and farmers and the impacts of mental health on farmers, those financial issues, the fear of losing the farm, the fear of not wanting to be, my personal fear, and I'm not a full-time farmer. I'm certainly have other things that I do, but I don't want to be that generation that messes this up. And so, I've got 135 years of farming history and family history. So there's a burden I carry on my shoulders of wanting to continue that tradition on. And so many individuals, in Iowa carry that with them. Early on, with COVID, certainly many farmers were concerned about what is this going to do to their income, and much has changed. And so what is the good news? We know that family impact on cumulative stress. We know that the more protective factors that are in place The more positive things we have going, the things that reduce those negative impacts, the more of those we have, the better. I harken back to my childhood. Here I am spending my 5th birthday in Hawaii. So I remember, always traveling growing up. But I remember the year we stopped traveling for probably 3 or 4 years. And that was in 1983. And I think, some of us remember what happened in the 80s, and it was very different than today. Today interest rates are very, very low. And so a great deal has been buffered. But in 1983, that was the original farm crisis. And so many farmers suffered during that. And so my family was also one of those families that suffered. And so I remember that. And so, we need to think about how everything we talk about doesn't just impact individuals. It impacts their entire family. It impacts their entire community. During a pandemic, it's changed the way that we are able to support each other. It changes the way we're able to engage. And so when we think about seeking help, traditionally, why don't people seek help? People don't seek help because they're not aware or recognize that their struggles could be causing them difficulties. There's a mindset. Their stigma is very strong. Stigma is for sure very strong in rural communities. Cost, I indicated health insurance. Many health insurance plans, especially those that small businesses buy, don't have parity, and access can be very difficult. So, we have to work together to help to manage those things. Some other risk factors specific to rural communities: suicide rates are increasing across the country. There are more people die by suicide in the state of Iowa every year than die in motor vehicle accidents. And so, we need to understand that those folks in isolation in rural areas with lower social cohesion or social networks, areas with more gun shops, and especially rural areas with veterans in them, have much higher rates of death by suicide. It's always good to remember what's the best simple ways we can reduce suicide: storing firearms, locking and limiting medications, and identifying support systems. It's very difficult to have those conversations sometimes, especially with family members, but it's important that we're able to do that. So what can we do? What can you do, whether or not it's at your workplace, in your community, working with others, in your church or place of worship? Connections can happen. They just look very differently in 2020. 2020, it's a 4-letter word. Many people tell me. And so what do we do these days to make connections, and how do we make connections differently than we used to? One way that I find I'm making connections is, I'm on Zoom, I think pretty much all day, every day, it seems like, or WebEx or GoToMeeting or any one of the other suites of connection software. But one thing I've learned is that that's a great way to connect with people. Even my Kiwanis Club meets every Friday. And so before the pandemic, we would meet lunch at noon at the country club, and we would have programs and we'd talk. Early on in the pandemic, we're like, well, we have to keep going. We started doing Zoom, and I was hesitant. I'm like, I don't believe people are going to come. And believe it or not, every Friday, I start a Zoom meeting, and we have probably 40 people. And we have clubs joining us from other parts of the state of Iowa. We've had people join us from other states. And we have members who will get on that meeting a half hour early and still be talking a half hour after the meeting, just like we were standing out in front in the parking lot at the country club. So I have to say I was proven wrong, that connections still occur. They just occur differently than what we thought. And so I've been impressed and shocked by the way that technology has been taken up and embraced by folks that I didn't think would be able to do that. So it's been a learning opportunity for me, and I think it's been a learning opportunity for many others as well. I think that creativity drives us to be more innovative. And so as we become more innovative, we get stronger, both as businesses and as those who support others in finding ways to deliver better services, better care, and do things differently. It also gives us an opportunity to be resilient. And so as we start to think about how do you create resiliency in your workplace, how do you create resiliency for those around you, what is it that you're doing to protect us from the next thing that comes along? I was doing some, I shouldn't joke, but I do debriefings and stress diffusions, and sometimes some of the folks, are in really high risk essential populations. And so we do stuff with, emergency management agencies across the state. And so there's kind of a running joke that we're preparing for magma flow, because what else could happen in 2020 that we couldn't prepare for? And so maybe a volcano eruption, and so, at some point we kind of have to be able to and maybe it's dark humor, but have some recognition that this has been challenging for everyone. And so how do we kind of help to make the best out of where we find ourselves to be? And are we willing to talk openly about mental health and wellness, and how important it is that we take care of ourselves? We need to be able to take care of ourselves so we can take care of our families, so we can be there for our coworkers, so that we can continue to be the best that we can be, so we can be there for other people. And so, we want to always encourage people to use EAP programs, really look at what employee assistance looks like. How do you provide employee assistance to your employees? What other types of campaigns, public education and awareness campaigns? In Iowa, we have the Make It Okay campaign, which is a great program to use alongside an EAP program to have those conversations. Do we support our local schools in having programs that talk about mental health, that talk about suicide prevention? It's always good to promote those crisis and warm lines that are available across the state. I'll show you a couple of those here in a minute. It's always good to talk to local law enforcement communities about how to help to reduce risks in your community. Screening tools implemented in local community health centers and hospitals. Helping to support connecting communities in different ways that address the isolation that we face as a result of COVID and the COVID mitigation strategies that many of us find ourselves being part of and being implemented around us. It's impacting everyone differently. I can tell you that you just can't go tailgate in front of before an Iowa State game anymore, and so that's a great social avenue for a lot of people sometimes. And so that's very different this year. And engaging in suicide prevention trainings and education, and learning those mental health literacy skills is also important. Some examples of training, and one of the ones that I really like to talk about is mental health first aid. Mental health first aid is a one-day class. It used to be a one-day class that I'd come in and teach 30 people a curriculum that is evidence-based, that over 3 million Americans have been trained in over the last 12 years since mental health first aid came to this country. We've had to step up to the times. In June, mental health first aid came out with a virtual option, and so now we're able to go through an online course for 2 hours, self-paced, and then we meet by Zoom for up to 5 hours, where we watch the videos together. We break into breakout rooms in small groups and talk about things and talk about scenarios. talk about why individuals don't seek help, talk about how do we help to bridge the gap when professional help isn't on hand, and then how do we respond? How do we teach others around us to respond and be supportive and listen to the needs of those around us? And so it's really been a learning opportunity to look at how can we train differently in communities, and how can we provide support and provide that much needed education. So as we go through this and as we think about promoting wellness in the places where we live and work, how can we do that in a way that's informed, that is non-stigmatizing, that uses mental health literacy in a way that promotes those protective factors and supports creating, a healthy environment, not only for employees, but for their kids and their families as well. So some of the things you learn in youth mental health first aid, we talk about kids, we talk about law enforcement, we talk about depression and postpartum depression, and really talk about the facts of the difficulties that women face. We talk about the facts around the difficulties that men face and their risk factors. We talk about special populations, Hispanic and Latino communities, and of course we talk about mental health first aid at work, and how mental health first aid at work can create a culture of health and wellness, increasing productivity, engagement, loyalty, and a goal orientation. And so really, the purpose is to recognize those signs and symptoms of someone struggling, to teach the skills on how to reach out, and then for us to feel comfortable connecting with a distressed person, and having that difficult conversation. If we see those risk factors and signs, and we feel like someone's not doing well, to be able to ask them straight out, are you having thoughts of suicide? Do you want to kill yourself? One of the most important things we can do is, if we're concerned with someone's safety, is to ask the question directly and without dread. What we know about isolation, such as what we've experienced with the pandemic, we're also seeing increased substance use with this pandemic. What those two indicators unfortunately do are both of those things correlate with increased suicide attempts and deaths by suicides as well. So it's really important at this time, with all of the stressors and traumas and the responses that we're seeing from folks, that we become very in touch with our wellness, with our emotional well-being, and be able to have those conversations so we can reach out and talk to folks. One of the things that you do have at your disposal right now is the FEMA response. The FEMA emotional behavioral health response here in Iowa is COVID Recovery Iowa. And that is a crisis counseling program that is available to every Iowan impacted by COVID. And so that can be accessed by calling the Iowa Warm line at 844-775-WARM, or the Iowa Concern Hotline, which is part of Iowa State Extension, which was created in 1985, just as I talked about of what happened to my family in 1983 in the midst of the farm crisis. And that number is 800-447-1985. That's where the number came from. And so the crisis counselors help support people. They don't supplant any counseling services or EAP programs already in place. They're there in addition to that. It's a temporary, it's going to be through June of next year to help to assist people in making connections and decreasing isolation as we manage through both the disasters of the derecho as well as COVID. And so that's a great resource to have. I do a lot of workplace debriefings and workplace diffusions where we process with teams of staff their challenges they have. Many staff are struggling with working from home, having their kids going in and out of isolation and quarantine, and that's very disruptive in the workplace. So it's really good to have some supports that you can give employees, or you can give coworkers, or you can share with others about what can be done. There's personal supports available, virtual groups and activities. I talked about the workplace stress diffusions. And of course, many educational programs, very similar to this one, where we go in and just have the conversations with folks about how they're doing. So a lot of times we'd have an interactive program where we try to talk about something like this. And just to put it in perspective, you know, I kind of went back in my own history. As you can see, I've kind of been in it. My wife's had a lot of time to be doing a lot of genealogy stuff as we've been on break for the last 6 months. And so I've kind of gotten into it as well. And so in 1918, my farm happens to be in Boone County. The Spanish flu pandemic and tornadoes caused significant disruption across Boone County, destroying many things. And here we are in 2020, and we have a pandemic and a significant storm that caused significant disruption. This storm too shall pass. You know, what's important is what are we going to do to support each other as we move through this disaster, and as we think about how do we become better and stronger as a result of being part of this time. And so really thinking about that support isn't short term, it's long term, and what are we building into our plans to be resilient over the long term. So kind of with that, you know, think about the EAP benefits, and if you're using those EAP benefits, and what the next steps can be for you. Now, I'm happy to take any questions you may have.
This is Johanna from EFR. Thank you so much, Jason. Yes, please ask questions. Use either the chat or the raise your hand feature. I'm going to go into the EAP benefit slide in a little more detail, just for anyone who might be joining us today who has not been on one of our webinars, or maybe is less familiar with our benefits. But if you're joining us today, you most likely have EFR's EAP benefit through your employer. And I want to remind you that this is a benefit that is at no cost and confidential. It's for you and anyone living in your household. And so this slide just kind of gives you a snapshot of some of the services available and some of the reasons why you might want to reach out to EFR. We always say life happens, we're here to help. And so whatever's going on in your life that's causing concern or stress or worry or frustration or anxiety, if you name it, we can at least be a great place to turn to, and we can hopefully help you and identify resources that can help you. So our 24-hour phone support is 800-327-4692. You can call that number to ask questions about your benefit. You can call that number to engage with the benefit. So depending on where you are, there are some counselors seeing people in person, but there are also a lot of telehealth options available. So it's in person or web-based counseling. We have telephonic financial and legal consultation. We provide elder and child care resources, identity theft resolution resources, and life coaching. So a lot of great benefits for you and anyone living in your household. And again, it is a completely confidential benefit. We're a confidential resource. The EAP is not a benefit that you have to enroll in during open enrollment. So a lot of times people forget that they have it because they've never used it, or they don't remember checking the box that, oh yes, I would like an EAP. Well, you have the EAP and you are welcome to use it at any time. I also want to make an announcement for the next webinar we have upcoming, and that's also with Jason. This webinar will be on Wednesday, September 30th, so 2 weeks from today. And the topic is COVID recovery, emotional support for those impacted by COVID-19. And it's basically about the current pandemic and even the derecho for those of us affected in Iowa, are the disasters that have disrupted our day-to-day activities and really, like Jason has mentioned in the webinar today, increased anxiety and depression. So we're just going to be exploring the impact of kind of that compounding stress and how it can affect every person, every aspect of your life. So that again is 2 weeks from today at 2 p.m. The only question is, there are a lot of billboards in Missouri that talk about farmer suicide. You notice Missouri have higher rates of farmer suicide, or as a state, are they being proactive about it? More billboards along Interstate 35 once you get into Missouri about farmer suicide.
That's interesting. Missouri is not one of the states that usually comes up as being very proactive. So that may be a new initiative that they've started. Minnesota has some really good resources. I'm familiar with them. And actually, if you want to go to an interesting website, Save a Shore Farmer is Maryland's agricultural outreach, and they've done a lot around mental health literacy and identification. There's very high rates of suicide in the fishing industry. So, you see agriculture look different, across the country. And so that's interesting. I don't have a breakdown. I have it somewhere. I don't have it off the top of my head of the number of agriculturally related within the sectors of how that death by suicide comparison breaks out. Per capita, South Dakota, Nebraska, Iowa, Illinois, it kind of seems to go kind of north and west a little bit, is higher risk areas. So that is interesting.
Well, it looks like that is it for our questions. Jason, thank you so much for your time and expertise today. We really appreciate it. This webinar will be on our website within about 24 hours, so please visit www.efr.org/webinars to find this webinar recording and other webinar recordings that we have facilitated in the past. And I hope everyone can join us in a couple of weeks for the next webinar. Thanks, everyone. Thanks, Jason.
Thank you.